Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Kelley Butler. She's a family medicine resident and member of the Committee of Interns and Residents, SEIU. Her KevinMD article is titled, "To Improve Healthcare, Respect Doctors' Humanity with a Living Wage." Kelley, welcome to the show.
Hi, Kevin. Thanks for having me.
So we'll get into your article in a little bit. First off, just briefly share your story and journey to where you are today.
Sure. So I'm a Los Angeles native, born and raised. I come from a background of folks that are mostly in corporate American education. So it gives a little bit of an inkling to why labor matters to me. I went on to Howard for undergrad, which formed a lot of my politics, moving through a historically Black university. I come from a long lineage of people that were trained in those systems of education as well. Went straight through to medical school at UC Irvine, and now I've landed here at UCSF for residency. Being in San Francisco has been really interesting and really empowering. I'm lucky enough to say that I really like my program, so that's beautiful. And what this opportunity has also presented in being in San Francisco is to really flex the muscles that is being a physician advocate. A lot of that was informed for me in medical school, understanding that so much of the health reality of a patient was dictated outside of the exam room. And so much of how we move through the labor force was dictated by our own social action as, at that time, medical students, and now at this time as residents. I don't think we can really rely on the system to do right by us and for us on its own because it wasn't designed to. Residents were not created in order to be treated well. That's not where that comes from for us. And so now I've taken up the helm of leadership in our union space. And it's been a beautiful place to flex my interests in policy, in advocacy, in making our lives a little bit better. How we make sure that we can show up with full cups to pour from for our patients. And that's a lot of what my article explores, how we're not pouring from full cups and why that is.
Now, before we talk about your article, you're a member of the Committee of Interns and Residents, SEIU. Now, for those who aren't familiar with that organization, just tell us a little bit about that.
The Committee of Interns and Residents is a local of SEIU. We represent a little over 25,000 residents and fellows across the country, specifically 11 states. We are the largest union that represents residents like myself, or people that are in training, doctors in training, and we represent their interests. Everything from how we show up in the workplace to what kind of work we do when we get there to how we're paid. And my specific role in this union space has been as the president of our bargaining unit here at UCSF. I act as a delegate to the larger national organization on behalf of UCSF. And I'm influenced and influential or involved in our Committee on Political Education, which is our political action committee, where non-dues, donations only work is happening to move legislation and political agendas forward that support both our interests as trainees and those of our patients.
Your KevinMD article is titled, "To Improve Care, Respect Doctors' Humanity with a Living Wage." Now, how did your article come together?
Out of desperation, moving to San Francisco, I thought I had a grip of what it meant to live and work in an expensive city. I outlined, right, that I'm from LA, went to school in DC. I didn't mention, but I went to school in Boston too. So I thought I knew what it was like to go to work and live in an expensive city. And was I wrong? I'd never thought that after I'm in school for the last 12 years that I would be living paycheck to paycheck, hand to mouth. I did not think that was going to be my reality as a physician. I'm a doctor. I take care of a lot of people. I'm of the workforce where if we didn't show up to work tomorrow as physicians, the system would crumble. The system is deeply reliant on our labor. Silly me thought that would mean that I would be comfortable at a minimum, that I would have my basic needs met and maybe a little bit enough to save or think about starting a family. I didn't think that was such an incredible ask, but apparently it is. So my article details the financial reality that is encountering a vet bill that's about a quarter of my salary and the brakes on my car breaking down at the same time. And the fact that my partner and I, who are gainfully employed resident physicians, couldn't afford to fix or do either, let alone both. Now, when you're thinking about making decisions about things that are necessary to live, like a car to get to work or your dog's health, you shouldn't then be struggling in that reality, especially not if you donated and dedicated so much of your life to this field. I just don't think that that's an unreasonable ask to be able to have our basic needs met, to take care of our families, to take care of the emergencies, to not let something like a $1,000 vet bill equal financial ruin, right? I don't think that that's unattainable, or it shouldn't be. And so this article comes from a place of being deeply unsatisfied with that reality and really challenging the idea of how we as residents and largely healthcare workers across the entire healthcare system are compensated for our contribution. Because again, if we didn't show up to work, things would go really, really wrong. People would suffer. People might even lose their lives. That's how vital our contribution is. And what this article and largely what this legislation that we're pushing for asks is that our contribution match our compensation.
So give us a sense of, in general, how are residents compensated these days? Because it's been decades since I was in residency. So just give the lay of the land of the financial landscape. Is this specific to high cost of living areas like San Francisco? Is this happening across the country? Just give us a sense of how pervasive this issue is among resident physicians today.
This is not an issue that's unique to residents in extremely expensive cities. The reality for residents is we're making, on an average, something in the $60,000 per year range, boasting $200,000 debts that we're going to have to repay in a couple months, working 80 hours a week. And when you do the math, we get paid less than minimum wage for the work that we do. That's not unique to San Francisco. It's pervasive. And so when we are thinking about legislation, Bill 525, which would establish a basic minimum wage for all healthcare workers, not just residents, of $25 an hour, it's in order to lift up the entire system and to also set a precedent that this is possible, that you actually can pay people to equate their worth, that it's not some fantasy that residents don't have to live in poverty, because that's the reality. Recent studies were published, especially in up here in the Bay Area, but out of Berkeley, it dictated that about 48% of the healthcare workforce in this state is dependent on social services like Medi-Cal or food stamps. So again, it's not something that's unique to residents either. It's not unique to California. It's not unique to San Francisco. It's a healthcare workforce issue. And that's why this bill is so important. That's why the organizing effort around this is so important, because it spans the entire sector. It's not just residents saying we need to be paid more. It's the entire system saying workforce shortages are impossible. I can't afford to put food on my table as a janitor, environmental service worker, cafeteria worker, nurse, etc. And that's unacceptable. People who are so gainfully employed, who have dedicated so much time to education and training, who do something as pivotal and vital and important as taking care of the lives of human beings, are reliant on public assistance. That's unacceptable. It just is. And so by lifting the minimum hourly wage for all workers to at least $25 an hour, it's going to lift up so many healthcare workforce sectors or parts above that level of poverty so they can better take care of themselves. That's what it's really about.
You alluded to this a little bit earlier. Tell us about how some of these financial stresses and pressures, how does it affect you as a resident physician taking care of patients?
I think the workforce shortage piece is the most important to think about when it comes to our worth not being matched with our compensation. If people don't feel like they can be reasonably compensated in the job, they're just not going to take it. What that means is my patient who shows up to the emergency room and says, "Hi, I have this complaint." Someone triages them, someone sees them and dictates that they need to be admitted to the hospital, for example. That person is waiting to get into a room because there aren't enough janitorial staff to clean it. That person is waiting an extra 3 hours to start their Lasix for their heart failure exacerbation, for example, because there aren't enough nurses to get the med to that person. That person might be waiting in the emergency room, waiting room for 4 extra hours because they had to close an entire unit of the emergency room because there's not enough staff. And here I am as a doctor who really just wants to do well by this person, practice the medicine, and I can't because of systems issue, because of workforce issues, because of shortage issues. That affects patient care. Guess what that person is going to do? Even though they're huffing and puffing, can't breathe, are in an exacerbation, really need some support from us, they leave. They leave because they don't want to wait, because the room couldn't be turned over. There wasn't enough nursing staff. There wasn't someone to cart them upstairs to the room on the inpatient floor. That's unacceptable. That someone could then suffer because we couldn't figure out how to compensate our workforce enough. That's what it feels like. Beyond that, it also means that the moral injury that we experience as physicians is not even thought to be addressed. As residents, especially when we are dedicating so much time to this profession, and willingly so, we sign up to do this for a reason. I have my reasons for being a physician, and that hasn't left me. But it doesn't mean that I should be expected to suffer. So I want to address the moral injury too that can be somewhat qualmed or ameliorated with adequate compensation, is that at least if I've gone through the ringer, I've gone through a hard day, I've taken care of patients who had had COVID and died in front of me, et cetera, all the trauma that we know and well, right? At least I'm not then going home to an empty fridge. At least, right? That's what I mean about the moral injury. At least I can go home to some comfort. At least I can put away for savings. At least I can afford childcare while I'm at work for 14 hours a day. At least, right? And that's what this bill has made possible with the mobilization of a lot of people like resident physicians.
So tell us about the role of the union. So what is the Committee of Interns and Residents? What are you guys doing about this?
So the Committee of Interns and Residents has really taken up the helm in identifying some legislative partners and introducing Senate Bill 525 into the legislature. In this effort, we've had to have really good conversation and dialogue with our partners in the legislature in order to make sure that this is something that could actually get through. And so we've made some concessions. For example, the legislation has changed. This is a really dynamic process, and the bill provides for 25 an hour for healthcare workers in California still. But now in the updated bill, it's just 1.5 times the rate that we would be paid. So that means a minimum resident salary of about $78,000 a year. Now, for full transparency's sake, some of us are making more than that, some of us are making less. And so I'm really excited to be able to uplift the residents that are making less. And that's what our union is able to do. Our union, with contributions to our political action committee outside of our dues, we're able to push legislation like this forward that not only uplifts us as residents, but the entire healthcare workforce. We're able to show up in Sacramento and shake the hands of legislators and say, this is why this matters to me, and this is why I'm bringing this to your attention. With the support of my union, I'm then able to take that legislative effort and power back to my bargaining unit at UCSF and see, hey, look what we're doing at the state level. Can you match that or do better? It's the ability to work in a collective space, because the voice of one resident, while powerful and meaningful, is simply not as strong as the collective voice of our union. And that's what it means to be a unionized resident. To me, it means that your voice and your needs are heard because there are so many more voices about the same thing than just you. It also means that the concern that's probably shared amongst you and your co-residents is not lost in the void. It means that it's uplifted, enforced through contract language, and addressed via legislative vehicles as well.
So give us examples of some wins that your resident union or resident unions across the country, what are some measurable wins that you have gained?
I'm really proud of what we were able to do at UCSF, actually. Our bargaining cycle was a long one and a grueling one, but a rewarding one. We came out now as the highest paid residents in the country, even though we are still considered low income in San Francisco. We managed to win a fertility benefit because a lot of our reproductive years are spent working. So we don't have the time to build families. And I already spoke to how we don't have the financial resources to do that either. So now we can do things like freeze our eggs, or go for infertility evaluations, which is an unfortunate reality for us as residents. We managed to double our parental leave from 2 weeks before us being unionized to now 8 weeks. Again, woefully insufficient, but still a win. We managed to protect some of how we are able to access personal protective equipment. And if we don't have things like masks walking into a room with someone with tuberculosis or proper lead to cover us as we walk into a room where we're going to be exposed to radiation, we can actually then grieve and even escalate that grievance. There's a number of different things that we are really proud to have won here at UCSF, and things that I hope that our partners at other shops who are still in bargaining can win as well. Looking at you, Stanford, looking at you, Massachusetts General, looking at you in Boston, looking at you in Pennsylvania.
Take us into that negotiating room. I've always wondered, what's it like negotiating with people that could be your colleagues? So what's it like when you're negotiating for these wins?
I personally think that it's a little bit of an opportunity to take the power back. So much of our lives as residents is dictated by someone else. Our schedule, when we show up and go home, who we see, what we do, how we're trained, who trains us, none of that's dictated by us. Not even really where we go to train is dictated by us. We just put in an application into the computer abyss and hope that it spits out a place that we would like to be. So much of our reality in the workplace is not dictated by us. Contrary to popular belief, we don't negotiate a salary when we are hired, like most people in the workforce do. We don't get to say, here's the time that I'll take off. I can't just request paid time off anytime that I want to. So much is out of my power. And the bargaining process for us is the opportunity to take some of that power back. What it also means is that I have the opportunity to connect with people across programs. You can often feel really siloed as a resident just in your program or your field of study, that you don't have the opportunity to connect with the other members of your resident workforce. And that's what bargaining also afforded, this chance to hear about the concerns about lead and radiation, because that's not my reality as a family doc. I don't understand that struggle. I don't know what it means to go to work and to not have lead. I don't know what it means to lose a child that was in my womb because I was exposed to radiation. I don't know that as a struggle, but my co-residents and co-fellows did. And so when we're able to come together in that bargaining room, it's about making sure that, again, that complaint, that need is not lost in the void. And that's what bargaining affords. That's being a nice program affords, that you can have that interplay and dialogue between people. It also affords this political mobility that I think is pretty incredible. It also means being across figures who are mostly operating on Zoom, from people that are trying to protect the interests of the institution, which are often quite contradictory with the interests and needs of residents or the people that are uplifting and supporting said institution.
We're talking to Kelley Butler. She's a family medicine resident and a member of the Committee of Interns and Residents. Her KevinMD article is titled "To Improve Healthcare, Respect Doctors' Humanity with a Living Wage." Kelley, tell us some of your take-home messages that you want to leave with the KevinMD audience.
That physicians have power. I want to make sure that everyone who's listening to this knows that you have power. If you're the physician, the medical student, the resident, the fellow, it doesn't matter your stage of training, you have power. You have power to effectuate progressive change for your patients and yourself. There's no need for you to suffer at the helms of this system if you don't have to. I also believe strongly that unionization matters. And I'm so excited that we've had such a new swell and wave of people coming into our unionized space. If you can, seek it out. If you want to ask questions of us, head over to our website, set up a meeting with one of our organizers and learn more about what it means to be unionized at your program or your work site. We can do this if we do it together.
Kelley, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.